Much appreciated. So who are we? So who is this talking head that's talking at you tonight? So I'm Hannah. I'm the executive director at Policy Matters Ohio. And Policy Matters is a research institute. We mostly look at how the state policies, so state budget and tax and economic policies, are helping everyday Ohioans. Uh, and we are going to play the role of your host tonight. And if you enjoy the things that we're presenting, if you like the information that you hear tonight, please connect with us through our newsletter, Saturday Stats, through social media. You can also have our email address at the end of this presentation, so you'll know exactly how to find us. Now, before I turn this over to our speakers, I'm going to cover some logistics, just how this thing works, okay? So we did invite both of Ohio's senators, Senator Moreno and Senator Husted, to join us tonight to participate in this conversation. And unfortunately, they were unable to attend. Now, even though they're not here, we're going to do our best to capture the concerns, the questions, the comments that you all share during this conversation. We're going to also record this webinar so that we can offer it to more Ohioans and do a better job at capturing those concerns and questions and comments for sharing. The caption function is on, so if you are struggling with hearing or following my voice, please feel free to hit that button at the bottom of your screen for captions. We will be sending a ton of additional resources and materials to support you in learning more about how to take action. You will get this as an email following this event. We're going to drop a lot of things in the Q&A box as well, but have no fear, the summary email will follow up, and so you'll have all of the information in one spot. Also, this is a pretty big room tonight, right? So we want you to participate. We want you to share your questions, and we want you to be aware of how big this room is, okay? So there is how we go about that. There is a Q&A function at the bottom of your screen. There's a question mark icon. In that icon, you hit that, you can type in your question, and we have a bunch of experts on, speakers and staff to help manage those questions. So please use that Q&A function throughout tonight's conversation. We're going to try to answer some of those questions live as well, so don't worry about interrupting, just plug your question in as soon as you got it. And now we also want to encourage you to share how these changes to Medicaid may impact your life of your family or your community. But please be cautious in sharing personal details or information, because again, this is a pretty big room tonight. So we have a couple of ways that we're going to try to help facilitate that, to amplify your story and to capture that. We'll link those in the Q&A and in the follow-up email, okay? Sort of hanging together? Looks like we got some Q&A going already. Excellent. One more slide, Michelle. So before we begin, I just want to share with you all why now, why tonight, why this week is so important to this conversation, and why taking action now is so vital to the outcome that we're going to see from this federal budget process. Next one. All right, here it is. The time is now. We are just on the returning third or passing third, and we're heading toward home in terms of the federal budget. So the House passed the budget along the budget reconciliation bill along to the Senate. The Senate is now making the decisions about what they want to see in their version of this bill in this package. So now is the time to voice those concerns, to ask those questions, to let your elected representatives know that you are concerned and committed to following this process along and taking action. Next slide, please. All right. And there's some really important dates coming up. So if you are part of an organization, part of a community, and you want to have an in-person meeting with your elected representative, there's some key dates coming up when they'll be home. They'll be in district. Next slide. At the same time, if you're feeling overwhelmed, this is part of the reason why the Ohio state budget is also rounding the corner to come home. It is also with the Senate. We just got the Senate's version of the state budget bill today. And so it's also at this really critical time that if you are a person who cares about Medicaid and cares about the health of Ohioans, it's the time to act now. Next slide, Michelle. So you can see it's a very fast pace. Few more weeks and we're going to have the state budget wrapped up. So this is the time to take that little bit of time to make that outreach effort to get in contact with both your federal representatives, your federal Senate senators, and your state senators. Okay, we're going to break this down a little bit more for you, but just know that the effort that you're making now is valuable. One more, Michelle. And that's the whole game, right? Your story, your voice, how this impacts you really does matter to lawmakers. And I know it can feel discouraging whenever elected officials are non-responsive, whenever they're not attending the meetings, you're not getting meetings like tonight, right? I know that can feel frustrating. But let me just assure you, it absolutely matters. Those calls, those emails, they are counted, truly tallied up. So people know where people are calling from and what they are caring about. That matters. Those requests for meetings, it matters. And this conversation, this timeline, the kind of complicated policy that we're trying to struggle through tonight is evidence of how effective people have been in advocating to protect Medicaid. You know, if you think back when we started these conversations, we were looking at direct cuts, wiping out Medicaid expansion, wiping out Medicaid for 700,000 Ohioans. And because of advocacy from people across the state, we have Senator Moreno on record saying he is against cuts. We have taken some of the worst proposals off the table. And we're seeing that the Senate's they're really going to have to struggle to pass something that they can maybe call it something other than a cut to make it work, right? So we get this talk of efficiency. We get this talk of work requirements. When we know at the end of the story, it's all cuts. And so that change is so significant. And it's because people like you made the time to do the work to learn about it and to make those connections and make those calls. Okay, so we are very fortunate that you don't have to just listen to me the entire night. We have experts. We have national experts, and then we have in-state partners that have on the ground insight into how Medicaid is working for Ohioans and what exactly is at risk. Okay, so we're going to take a pause, switch out the screen, and I'm going to get right into it. We're going to invite Che Gladstone from Northern Ohio, Ohioans for Budget Legislative Equality. I'm going to try that again. Let's just do it again. Northern Ohioans for Budget Legislation Equality, also known as NOBLE. So Shay, come on up and share with us what these cuts mean for the folks who are part of NOBLE, who rely on Medicaid and Medicaid services.
Thank you, Hannah. So, hi, everyone. My name is Che. I am an organizer, as Hannah said, with Noble. What we do is we bring a voice to a voice to the budgetary process. We want to give our legislators, personal insight into how their decisions impact everyday Ohioans. We are a coalition of organizations and individuals whose mission it is to bring voices of low-income Ohioans to the state biennium, budget process. Right now, our biggest thing that we are advocating for is the removal of the trigger language. As we all know, that trigger language can potentially eliminate healthcare coverage for, over 700,000 Ohioans. And so we definitely want to see that removed. We also know that cutting these programs will most negatively affect poor Ohioans living in those rural communities as well as poor communities within the bigger cities. And so it is just awful for everyone involved. As a single mom, this is something that is very near and dear to my heart. I, have benefited from Medicaid expansion programs in the past as a single mother of two. These programs have just been imperative as a parent to be able to provide healthcare coverage for my children, to be able to take them to the emergency if they do something crazy like jump off the bed because they think that they can fly, or just those things that children do. And without Medicaid expansion and without Medicaid programs, I would not have been able to do that. I actually love going down, to Columbus to give testimony at the different committee meetings, because I recognize that as my chance to provide insight that our legislators would not normally get from these reports that have been generated by all the experts that they have on staff. One of the things that I love to remind our legislators of is, two things. One, sick people cannot work. If we are sick, we can't work. And so that is definitely not going to benefit the state of Ohio. And then also, the people who are giving testimony, as well as those committee members, each one of our legislators also receive state funded medical coverage. And so, it is just my opinion that if you're not going to cut everyone's coverage, we should not be having discussions about cutting anyone's coverage. On a more personal note, as a parent, for example, working as a single mom, and I don't know if we have any other single parents, in this chat, and in this group, but if we do, you know how difficult it can be to work full time and still, be able to fulfill, your duties at home. And so, there's often times where your work schedule has to revolve around your childcare schedule, and that can limit the amount of time that one can work. That can limit whether or not someone is able to work full time. And so being able to have a security like Medicaid programs to be able to provide that medical coverage, whereas part-time employment would not provide benefits that are needed, has been a lifesaver. And so I like to, tell stories about how these benefits, have enabled me to provide braces, or not braces, but, glasses for my son, who, if I did not have, access to these programs, I would not be able to do. Again, it is so important for us to advocate that no cuts are made to these programs, not just for this budget cycle, but for budget cycles in the future, because people who cannot see, children who don't have access to glasses, how well are they going to do in school? Children who don't have access, or parents who don't have access to, dental benefits, that will impact, their health. And so that will also impact their ability to work. And so it all kind of goes full circle. Another example that I like to give whenever I give testimony is how important, these services have been to me. Speaking of, dental services, there have been times where, just I would not be able to access, being able to go to the dentist for simple things like a cleaning or being able to get a filling, because I would not be able to afford the out-of-pocket costs. And I think that our lawmakers sometimes forget how hard it can be, for the people living on the opposite side of the fence, that, Medicaid coverage is not a luxury. I don't think anybody really wakes up one day and says, you know what, hey, I really want to be dependent upon the state, for basic medical, services and things like that. This is something that is needed. But beyond all of that, these are things that each Ohioan is entitled to, each American is entitled to. Being able to live out your days in good health is something that, every person who lives in this country should be entitled to. And to have, those rights being deliberated about and, possibly being cut, to me is just the most un-American thing that, one can do. And so for people like me who would be most vulnerable, these truly are, a matter of life and death. I, have a member who belongs to Noble, Miss Diane Howard. She's almost 80 years old. And when she gives testimony, she testifies about how these cuts will impact adult protective services. Many of the long-term caregivers, they work part-time, they're home health aides or STNAs. And so, more often than not, the companies that they, work for, don't really provide, adequate medical coverage. And so, a lot of these, expansion programs are still needed, for these workers. Well, if they can't, access, these medical services, or if the medical providers are not able to, provide a livable wage for their workers because their funding has been cut, well, that is going to impact the care that, our older, Ohioans receive. That is going to reduce capacity. That is going to reduce staff. That is going to increase caseloads. That is also going to increase the risk of neglect and abuse for our older Ohioans. And so that is, something that we definitely have to think about as well. And so, I just really want to, before I close out, I want to just really, really drive home the importance of speaking to the legislators and, bringing information that is not readily found in a report to their attention, because it really does make a difference in the decision-making process.
Jay, thank you so much. There's so many things I could pull out from those comments, but let me just restate a couple of things. One is that the critical thing of providing information that people aren't going to see in a report or in the numbers, what actually happens, how this impacts actual people. And then this is about life-saving healthcare. If people don't have coverage, if people can't get what they need to have preventative care, to do the things that they need to do to take care of the most basic and fundamental thing in their lives, their body, what are we doing? This is about how people are going to be able to survive. And then finally, I want to appreciate the encouragement of getting people in, offering the testimony, and offering that story. Thank you, Shay. That's really incredible. Noble's always there with the state budget or working on these federal issues whenever they come up. So it's really incredible that you came on. And this is everyone's first opportunity of the night to take some action. So we're going to attempt a new thing for us here at Policy Matters and try to do a poll. See if our comms director extraordinaire can send this out to folks. Since we invited our senators to come and join us tonight, but they were unable to attend, we also asked if they could send an aide or another representative to come in just for a few moments to be with us here tonight and to hear what Ohioans are thinking and what their needs are in terms of Medicaid, what they really need to see protected. Since that's not possible and they couldn't make that time, we have put together a poll so that you have an opportunity, just as a participant, to share your concern with them. It's 2 questions. If you want to add that in, we're going to aggregate those and we'll make sure that they get to those to the senators and to their health staff. We'll make sure that they hear what you would have said to them if they could have showed up tonight. So this is your first shot at participation and engagement. We're also going to send along a letter, an action, an email that you can join that Noble is circulating that goes to Governor DeWine. that specifically asks him to be the backstop, to be the last person in the last barrier to protect Ohioans from this consequence of the trigger language that Shay had mentioned, right? So we're going to share with you that link. It is a pretty straightforward, simple email action that you can take that just shows Governor DeWine that, hey, hopefully this stuff isn't going to make it to his desk in the state budget, but if he does, it is up to him to do the right thing and protect Ohioans, okay? So we're going to get that out to you as well. The sign-in letter should be in the web chat, and it will definitely be in your email. All right, hanging with us? Using the poll? Let us know. We're going to contact, we're going to get information to our senators, even if they're not here with us tonight. All right, next up, I'm going to invite Laura to come on. Laura is a policy expert. Whenever we get stumped here in Ohio at Policy Matters, we call up the experts at the Center on Budget and Policy Priorities. And Laura's going to give us an overview of what's going on in this bill. How are these cuts disguised as maybe a work requirement? How are these cuts disguised as changes to costs? How do we pick this apart? We're going to give you the information that you need to make these calls and do some emails and defend Medicaid here in Ohio. Laura?
Hi, Hannah, and hi, everyone. Very glad to be with y'all today. I'll talk about the House Republican bill currently going through Congress that in total will cut healthcare funding by at least $800 billion over the next 10 years and lead to roughly 15 million people becoming uninsured, higher medical bills for millions more, and a weakened healthcare system in our country. Supporters of this bill have tried to cloak it as a way to cut waste, fraud, and abuse, claiming that it won't take healthcare coverage away from people who deserve it. However, the facts show the bill is an attack on the heart of the Affordable Care Act, targeting two of its most popular provisions, Medicaid expansion and the ACA marketplaces, which have helped millions of people gain access to healthcare coverage in our country. And contrary to Republicans' claims that their plans protect the most vulnerable populations, the deep cuts in this bill will fall squarely on the entire Medicaid and CHIP populations, will hurt entire communities, and lead to millions of people becoming uninsured, including children, parents, people with disabilities, veterans, working adults, people with chronic illnesses, and older adults. So how does this bill do that? One of the main ways that the bill takes coverage away from people is by standing up enormous red tape barriers to enrolling and staying enrolled in Medicaid expansion. More frequent eligibility checks for the Medicaid expansion group will double the chance that people's applications could fall through the cracks due to paperwork issues, processing delays, and other errors. Asking people to report their work hours on a regular basis or lose their healthcare coverage, as work requirements would do, will create a thicket of red tape for working people in healthcare, childcare, and service industries, and other people who get their healthcare coverage through Medicaid expansion, which we must remember includes parents and caregivers, people with mental health and substance use disorder issues, people with cancer who are receiving life-saving treatment, and many, many people with disabilities, because meeting the strict criteria to qualify for Medicaid on the basis of a disability is extremely hard to do. So a lot of people with disabilities and chronic health issues get their healthcare coverage through Medicaid expansion. Republicans supporting Medicaid work requirements claim that people who are working or caring for others or have a disability will be protected, but the evidence shows that attempts to streamline the process and create exemptions simply does not work. When work requirements were implemented in Arkansas, for example, 1 in every 4 people subject to the requirement lost coverage in just 5 months. Primarily, they lost their coverage due to problems reporting and documenting work status or exemptions. People who were supposed to be exempt weren't. The state experienced massive coverage loss and no increase in employment. If A similar work requirement to the one in Arkansas was imposed in Ohio today. CBPP, my organization, estimates that over a third of the 760,000 people enrolled in Ohio's Medicaid expansion program would lose their healthcare coverage. The House bill, I want to point out, is harsher in many ways, with more red tape barriers than Ohio's own work requirement that was recently proposed. And it's worse than what Arkansas, that we just heard about, implemented, because it would require people to provide evidence that they meet a work requirement or an exemption when they first apply to Medicaid as a condition of getting coverage in the first place. Georgia did this, and after more than a year of implementation of their work requirement coverage program, only 7,000 people have received health coverage. This is far less than 110,000 people who expressed interest. And the large majority of $8.8 million in state funds went to administrative costs and paying consultants rather than providing people coverage. This is no model to implement across the entire country, especially because the data already shows that work requirements are unnecessary. Most people covered by Medicaid are already working, and those that aren't are mainly caring for family, are ill, disabled, or going to school. When you take the coverage losses that we just talked about with the Medicaid expansion, along with changes to the Affordable Care Act's marketplace, such as skyrocketing premiums, shortened enrollment periods, and higher out-of-pocket costs, hundreds of thousands of Ohioans will become uninsured. The scale of coverage losses and healthcare cuts will have far-reaching implications beyond people covered through Medicaid expansion and the ACA's marketplace. Rising uninsured rates will increase uncompensated care costs for Ohio's hospitals and clinics. As the state tries to absorb these costs, along with the hundreds of billions of dollars in federal Medicaid cuts and huge cost shifts from cuts to federal nutrition programs, the SNAP program, Ohio will face enormous pressure on their state budget with fewer opportunities to raise healthcare dollars, because that is another restriction included in the House bill that will particularly hit Ohio. Ohio is among the states that would be impacted by two provider tax provisions included in the House bill, one of which Manat estimates will result in $46 to $60 billion reduction in Medicaid spending in Ohio over 10 years. And total Medicaid cuts would be even more when all the provisions are accounted for. It's hard to predict how Ohio will respond, but these cost pressures will likely lead to hard choices on whose coverage or benefits to cut, or which doctors and hospitals to cut payment to. State budget decisions, these kinds of state budget decisions could further impact the groups that are often touted as the groups that Republicans are trying to protect. It would impact children, pregnant people, seniors, parents, and people with disabilities beyond those covered in Medicaid expansion. People with home and community-based services would be a particular risk because of the expensive nature of providing those services. And whole communities would be hurt as provider payments are cut, and providers who serve the broad public across insurance types limit services or leave the area. So the bottom line is that 15 million people nationwide losing their healthcare coverage and rising healthcare costs for millions is not good for anyone. Healthcare systems are interconnected. Medicaid is a critical part of our nation's health ecosystem. With cuts of this magnitude, there is no way to insulate particular populations or avoid causing widespread harm. And shamefully, House Republicans are rushing to pass this reckless, harmful bill to pay for trillions in tax cuts that will largely go to the wealthiest among us. The Senate is hoping to vote on their bill by the end of the month, and decisions about Medicaid and SNAP cuts as well are being made over the next couple weeks. This is a critical moment to contact your senators and let them know that using red tape, bureaucracy, and paperwork to keep people from healthcare coverage is a cut by another name, and that Ohioans reject efforts to raise costs and take away health coverage from hundreds of thousands of people in Ohio and millions across the country. Thank you.
Oh, here we go. My enthusiasm got ahead of me. I'm
Mhm.
just saying a little bit of amen over here that we can call it anything that we want, but we know that these are cuts. These are cuts by a bunch of different names, a bunch of different strategies, but the end result is going to be the same. Hundreds of thousands of Ohioans, millions of Americans are going to be less healthy, less safe, less secure. And we have an opportunity here to do something about it, to let folks know that these cuts, this pathway, the way this is still a cut. And let me just say, this chat is hopping. And in one of the questions, wanted a little more information about Senator Moreno. And, this goes to show you that those calls and emails, when you're getting the canned letter and it's so frustrating, it still matters. So Senator Moreno is on record saying he would not support a cut to Medicaid benefits. And so one of the things that we can do as Ohioans is let our senator know that what is in the House plan is still a cut. This is still a cut, and we can do better. And so one way to do that is by calling your Ohio senators. We're going to include phone numbers and some talking points. Some of the information that we are speaking about tonight, we'll have some of that in a little script or talking point form. We're going to share that out with you so you know exactly how to make that phone call, to share your story, and to let Senator Moreno, Senator Husted know that these cuts are cuts. Call them what they want, but Ohioans know they're cuts, and we need them to stand up and take action and to get a better deal for those of us back here in Ohio. Thank you, Laura. Next up, we are going to, unfortunately, Charlotte with UCAN, which is another excellent Ohio organization where you can get information about health, about our healthcare network, about medical debt, questions around Medicaid. I strongly encourage you to reach out to Charlotte's organization. We'll share some of that in the chat. She unfortunately had a family emergency, so we're going to send her our thoughts, our prayers, and make sure that you get the information that Charlotte would have been able to provide in your follow-on email. So you'll have that, and you'll know where to find UCAN as another excellent in-state resource to stay on top of all the stuff that's moving in terms of health and healthcare policy. So instead, we're going to go ahead and invite Zach up. Zach is our partner with the Ohio Association of Foodbanks. And you might be thinking, what's Foodbanks got to do with Medicaid? Well, you know what? They are experts on the things that Ohioans need to have stability, the things that Ohioans need whenever they hit hard times. And so Zach's going to come up and give us a little bit of an understanding about how hard it already is for Ohioans to access these services. And so when we're talking about these extra bureaucratic requirements, why that has such a outsized impact on how Ohioans can connect to healthcare or to things like food assistance. Zach?
Thanks so much, Hannah. Able to hear me okay? Great. Well, my name is Zach. I'm the Senior Director for Strategic Initiatives at the Ohio Association of Foodbanks. Like Hannah was saying, we represent the 12 food banks in the state of Ohio that collectively provide hundreds of millions of pounds of food to Ohioans each year. In addition to that work, we also do a significant amount of public benefits outreach and enrollment. So we are working with our state partners in executive branch agencies and our legislators to identify barriers to accessing public benefits, including Medicaid and SNAP, or the Supplemental Nutrition Assistance Program, here in the state of Ohio. And working towards solutions that make it easier to access those programs. And as we look at the proposals, not only in the federal reconciliation bill, but also in the state of Ohio budget, um, we see that these changes to Medicaid and SNAP, again, I'll just echo the call that no matter what we call them, these changes are going to lead to reduced coverage and reduced enrollment in Medicaid and SNAP, increased administrative burden for not only the people who are on the programs, who is our primary concern, but also for the state and county agencies that are responsible for administering these benefits. And then ultimately, this is going to lead to more hardship and less stability for Ohioans. And that is the message that we really need to be communicating to our Ohio representatives and our congressional delegation in Washington, D.C., with particular focus on those senators in the next couple of weeks. So Laura did a really good job of breaking down the cuts at the national level. I'm going to provide just a little bit more information on the Medicaid and SNAP programs in Ohio, and then point you to some resources, which I just saw Kate drop in the chat, that you can use in your outreach to senators and representatives. So in the state of Ohio, our Medicaid program provides health insurance coverage to about 3 million kids, parents, childless adults, and older adults in the state of Ohio. We do that through shared funding with the federal government through what's called a federal medical assistance percentage. And that's really wonky, but at the end of the day, what it means is that for every dollar that is spent on the Medicaid program in the state of Ohio, about 2/3 of it is coming from the federal government and 1/3 of it's coming from the state. Back in 2013, if you can remember back to the debates that I'm sure many of you were involved in around expanding Medicaid in the state of Ohio, we had a major coverage gap. People with incomes below 138% of poverty who were not in another eligibility category were left out of the Medicaid program. In 2014, through our action as advocates and in partnership with our legislature and our governor at the time, expanded Medicaid to close that coverage gap. And today, that means that Medicaid expansion, the Medicaid program is available to about 770,000 people in the state of Ohio. And the Ohio budget that's now going through would effectively eliminate coverage for that group if the federal government were to reduce that federal medical assistance percentage, or FMAP. And so that's why it's so important that we advocate with our state legislators about changing that trigger language. And I'm going to defer to Che, who did an amazing job describing the importance of advocating for a change in that trigger language. The federal budget would also further reduce coverage through work requirements, reduced funding for the program, particularly administration of the program at the state level, and then increased cost sharing for states. All of those things would just make it harder for the state of Ohio to continue providing access to benefits at the level that they are currently, like Laura outlined for us. The Center for Community Solutions and the Health Policy Institute of Ohio have developed some really good and detailed information about the scope of Medicaid coverage at the county and congressional district levels, and also some important research about the potential impacts of changes that are proposed at the state and federal level. And one thing I just want to point out is that HPIO put out a recent estimate that if Group 8 in the state, or excuse me, if Medicaid expansion, I'll use the more common term, if Medicaid expansion were eliminated in the state of Ohio, more than 400,000 people would become uninsured. We would go back to where we were in pre-2013, pre-Medicaid expansion, and we would lose a lot of the ground that this group worked to gain. Really quickly on SNAP, which is the front line against hunger here in the state of Ohio. Right now, about 1.5 million Ohioans are on the SNAP program, and that SNAP program provides about $3 billion in annual benefits that go from people who are on the program to over 10,000 retailers in the state of Ohio. Proposals to increase scrutiny of eligibility for people on the program, enhance the already existing work requirements, and then shift costs for the program from the federal government to states would decrease the administrative efficiency of the program and again lead to reduced coverage for Ohioans. Um, the Ohio Association of Foodbanks has been working closely with advocates for Ohio's future on a nutrition policy work group that is activating fully on this issue. And we have put out some county fact sheets and some congressional district fact sheets that, again, the purpose of sharing all of these fact sheets with you and information is so that you can do really informed outreach to your legislators at the state and the federal level. I mentioned earlier that we do public benefits outreach and enrollment. And through that work, we experience firsthand with people who are in need of the stability that these federal benefit programs bring, the frustration of navigating the processes for accessing SNAP, Medicaid, HEAP, and other assistance programs. And what we see in these proposals from the federal and state level are things that would only increase this frustration. We have worked, as I mentioned before, in partnership with our legislators and our executive agency representatives on both sides of the aisle for decades to identify barriers to accessing public benefits and to implement solutions that work for Ohioans. And we, again, are worried about losing ground in that fight, frankly, through the proposals that we see at the federal and state level. And so we really want you to all activate and take action now by reaching out to your senators. And one way you can do that is by joining a group that is formed called the Ohio Medicaid Matters Coalition. That's a coalition of over 140 organizations that are specifically organized around the trigger language in Ohio's budget, and also getting more organized as we learn more about the federal budget on some of the funding changes that are proposed that Laura touched on. Also encourage you to sign up for the Ohio Association of Foodbanks advocacy alerts. And then finally, again, use the resources that we've provided through the Center for Community Solutions, Health Policy Institute of Ohio, and Ohio Association of Foodbanks to write informed outreach to your Ohio senators, representatives, and congressional district in DC. Thanks very much for the opportunity to be here.
Zach, thank you. I'm sure you couldn't follow the Q&A while you were giving your comments, but just note, it's been noted and declared that you are in fact a rock star of this webinar and in keeping and making sure Ohioans get what they need and staying on top of all of these moving parts and pieces. Zach gave you just excellent resources, excellent resources. If you didn't take all those notes, don't worry, we're going to have them in your email. So you'll have all the links, how to connect with those groups, the information that you need to make those calls, make those emails, and maybe even ask your senator for an in-person meeting. So one of the ways that we would like to encourage and support folks to make sure that if they're an individual or if they're in an organization, they really do have a clear way, the best, possible way to connect with their elected representative. We want to offer folks a little resource that we've written up on how do you go about asking for a meeting with your Ohio senator. So we're going to share that document. And then just know if you're looking through it and you're like, I've never done this before. I don't know how to talk to a senator. I don't know how to do. Know that we're here for you. So if you or your organization needs some support in setting up that meeting, if you want to maybe have a larger rally, you want to have a call-in campaign, if you want to figure out how you can engage, reach out to us. We're going to drop some of our contact information. You'll have that. We can provide some consultation so you can make that as effective as it can be, and that you have the support that you need, that you can go in and feel confident, and you don't have to worry about where am I going to get this data point, or where am I going to get that data point. You can go in and tell your story, and hopefully get one of the senators to connect, to listen, to make a change in what this legislation is going to do for folks. Okay. One more action alert, right? We have tried to put together, we have an email campaign for folks. So if you're not sure about making a phone call, if you're not sure about crafting a personalized email, we have an email template, a form that we can share with you to help you make that contact, right? So we're trying to give you lots of ways to get in touch, to let them know that Ohioans are watching and are still concerned about what is happening to Medicaid in this legislation. So we're going to add that link to the Q&A and to your materials. This is a link to a petition to the Ohio senators, goes through the Policy Matters Action Network. Please feel free to share this link with others. Again, so frustrating. I get it. We get it too. We've experienced it here tonight. And doing that outreach and trying to welcome and invite senators and their staff to participate, to join the conversation, to really see the rich content and information and stories that are being shared in the Q&A. And to get like, well, no, thank you. To get that form letter, it's frustrating. But it absolutely is essential. It's the secret sauce, truly, of American democracy, is having people contact their representative, their senator directly, and that still matters. You guys hanging in there? Doing good? I'm going to invite Elizabeth to come on and talk about how this is going to specifically impact kids and schools. I think we think of Medicaid as being like, oh, that's health insurance for people who are maybe low income. And as we've heard tonight, it's about so much more than that. So much more than that. And so Elizabeth is going to give us another slice of how this impacts kids and families here in Ohio and across the country. Elizabeth?
Thank you so much, Hannah, and I'm so pleased to be part of this conversation in Ohio. So Che and Laura and Zach have done an excellent job sort of going through so many of the points that I'm going to be making as well. But I just want to, again, reiterate what we're talking about. This bill that passed is 800 billion plus cuts to Medicaid and millions of Americans becoming uninsured and losing health coverage. That coverage, those coverage losses are how they get to those big cuts. And they're tying it up in lots of things like work requirements and trying to explain it in different ways. But this is really about coverage losses and some of the ripple effects that come with that. So I want to start. I mean, it's been clear through the other presenters that Medicaid is a critical source of health coverage for people across their lives, right? It pays for 2/3 almost of nursing home care in Ohio. It pays for 40% of the births, at least in Ohio, and 40% of kids in Ohio, at least. I think state numbers are actually a little higher. And And through all that, and then a lot of working parents and folks who are working in working families of all ages. So I want to start sort of looking at sort of what this looks like at the family level. I know Ohio has been a leader in really thinking about ways to use Medicaid to address the maternal health crisis, look at infant health outcomes, especially. And the cuts on the table would turn back the clock on the progress that Ohio and other states have made. So one of the ways is that a lot of these cuts target the Medicaid expansion, which we've all talked about already. And one of the things we know about expansion is it covers so many women before they become pregnant. That means they can get the preventive care they need to address their health needs. And when they don't get those health needs met, if they're untreated, those chronic diseases or health conditions come to their pregnancy and can put their pregnancies at higher risk. And we know from the research with the expansion that states that expanded Medicaid they have actually seen larger decreases in maternal and infant mortality compared to those states that didn't expand. The expansion is associated with better maternal and infant health outcomes. So that's at risk if these moms lose coverage before they can even get pregnant. And we know that a lot of, when they're pregnant, a lot of women rely on care in rural areas. Nationally, we know more citizens or more folks on Medicaid are in rural areas, proportionally are in rural areas than more urban areas. And in Ohio, it's about the same. So for women of childbearing age, about a quarter of women in rural areas rely on Medicaid for their coverage. That's a quarter, though. So if Medicaid, if their coverage goes away through Medicaid, or the hospitals that rely on Medicaid coverage in rural areas are forced to close, we know they're already in many places being forced to close, those same women, and not just women on Medicaid, but women in those communities will be forced to drive longer distances to give birth. That's already a challenge that would be exacerbated by these kinds of Medicaid cuts as folks are trying to make up for it. So that's not just true, of course, for rural childbearing, but it's also just true for rural health facilities and folks in rural areas who are as likely in Ohio to rely on Medicaid as those in urban areas. We know Medicaid expansion also covers many parents. We saw the rate of uninsured adults go down to low levels, just like Medicaid and CHIP have done for kids over time. And when those adults were able to enroll for the first time in coverage, many of them were parents, and they were able to actually improve coverage for their kids, because as more folks in the family get covered, all of a sudden folks who might have been eligible and they didn't realize they were eligible for Medicare or CHIP might come in as well. And so that's been a really important thing for the whole family, and everybody gets coverage, and that health coverage is sort of the culture of the family. But it's not just parents. We also know that Medicaid expansion covers many of the people who support working families and their communities. We've talked a little bit about caregivers and direct care workers. Child care workers are also many of whom are covered by Medicaid. In Ohio, more than 30% of child care workers in Ohio are covered by Medicaid, most of whom gained it from the Medicaid expansion. And these are obviously, these child care centers are small businesses, and it's really hard to afford coverage for everyone in small businesses. It's not just true of child care centers, of course, but Medicaid helps fill that really important coverage gap for small businesses like child care centers, and helps those families of those children work. But we've also heard about caregivers and direct caregivers like personal aides and Hope Health aides. That direct care workforce, 30% of that direct care workforce nationally is covered by Medicaid. I think Che mentioned them. But it also is this sandwich generation caregivers, many of whom are women. And I think I saw some of folks in the chat talking about caring for children or adults with disabilities. These are often women who've left the workforce to care for older children, or their parents who might need long-term care or support, might not be able to afford childcare. There are a lot of women who, for a variety of reasons, aren't able to work as consistently, and even if they are, could lose coverage. And then finally, just in terms of the direct effects here, there are a lot of children that could lose out on coverage, even outside of some of these expansion related provisions. That there's at least one estimate that says that just the added red tape to eligibility enrollment would mean an additional 600,000 kids will miss out on coverage they're eligible for, because of all the red tape. We know that a lot of kids, of course, and kids get health care and are covered by Medicaid, 40% at least in Ohio. And many of those kids are school age. And we've seen a lot more of a focus on health-based or school-based healthcare services. So a lot of schools or a lot of providers in schools are also relying on Medicaid to help pay those bills since there's such a large proportion of kids who are on Medicaid. It's important to think about, in addition to the direct effects if kids lose coverage and what that could mean for some of these school-based health centers or schools, but also the larger sort of budget implications that Laura mentioned, that 70% of the federal dollars coming into the state of Ohio, if you just look at the federal parts of the budget, are from Medicaid. If that goes down, that means you're having to compete for scarce state dollars to make up for those gaps or look for other places to cut in the state budget. And that could put another kind of pressure sort of on schools. But we also know that kids who have access to Medicaid in the long term are more likely to get to school ready to learn, to have better health outcomes, and actually have higher education and employment outcomes as adults. So while we are seeing all these short-term ways that kids could lose coverage, we know that in the long term, there are much better health outcomes, not just in health, but in education and employment in the long term that we could really undermine. So Medicaid also, like we've mentioned schools, most kids in the child welfare system are covered by Medicaid. Medicaid covers a great proportion of kids with disabilities. I could go on and on about the way Medicaid supports families in different ways, but I'll just leave you with this. Don't believe any suggestion that the largest cuts in Medicaid history would not hurt pregnant women, children, or families. There is no person, there is no family, there is no community, and no state will be spared. So we hope that you will tell the story of the importance of Medicaid for you, for your Ohioans, and families and communities in your state. So thank you so much for having me.
Thank you so much for joining us. It really is one of the big issues happening for us. And you can hear my hesitance in saying that. And that's only because there's so much happening right now, from food assistance to health to what we're seeing at the state level. We know there's so much going on. And while that can be complicated, it can be hard. It's taking your time. I know it's frustrating. We are frustrated with you. It is even more important to make that effort to be engaged, right? This is a strategy. If so much is coming out, then maybe we can get away with some of these things, right? So even more important to stay connected. And let me just tell you, all of you folks on this call have done that tonight. This chat has been incredible. The questions, what you're putting in the chat, the commentary, excellent. Very, very appreciative of that. And let me just say, there's really good question in here. What is all of these cuts? Where's that money going? The cuts, how are they? Why are we doing this? Where is that money going? What is that going to be used for? And let me just be very clear. Those dollars, that so-called savings, is going to offset the cost of tax cuts that overwhelmingly benefit not just wealthy people, but the richest people in this country and the largest corporations on the planet. I've shared in the Q&A a resource that will break it all down to you, but let me offer you this one stat from that report. The $124 billion in net tax cuts going to the richest 1% of earners in this country next year would exceed the amount going to the entire bottom 60% of taxpayers. Okay? That's where this money is going to go. We have the money, we have the resources, not just to keep and restore these cuts, but to ensure that every American, every Ohioan has access to health coverage and quality health care. We have the funds. We got the revenue. What we don't have is the political will to put everyday working Ohioans, people like you and me, those on the calls, your loved one, first, before the billionaires, before the mega corporations. Instead, we have legislators who are willing to prioritize tax cuts over ensuring basic needs, the building blocks of shared prosperity. So with that, you all, I thank you so much for joining us tonight. These questions really are excellent. I hope that you take advantage of the resources that we're going to be sharing and that we've shared tonight. We really are here to help you all take action, to engage, to understand what's coming your way. So whenever you get that follow-up email and it feels so overwhelming, just remember you can always email and call and reach back out to us. Make sure that those elected know that they're here to serve you, their constituents, your kids, your friends, family, and neighbors. And that is beyond political party. And the only way we can do that is if we make those connections and make that contact and make that effort. All right. So with that, I will return you all to your normal evening. I hope you have a wonderful afternoon, an excellent week. Call us up if you see a report that comes out. We're happy to talk to you about it. And truly, thank you so much for taking action to protect Medicaid for Ohioans and everyone in the country. Thanks so much. And as people are, if there's questions in the chat, we'll send them in the email. If folks are still on. We'll do our best to get those out. All right, everyone. Thanks so much for participating. We'll close the webinar room now and we'll follow up on email. Thank you so much to the panelists. Have a wonderful night.
Thank you. Bye.